I was going into the unknown. I was scared.
At first it was very, very difficult being away from family and friends. You're not with your usual people who comfort you.
Everyone is a stranger, but then you get to know them.
Some can feel very worried about coming into an inpatient unit and what we'll do. You know, it's not always a last resort. It can just be the right resort at the right time for a young person.
Hi, I'm Lauren. I'm one of the staff nurses at the Dewi Jones. I'm going to show you around.
The Dewi Jones Unit is an inpatient mental health facility. It has space for 9 young people, and it's designed to help children aged from 5 to 13 who are going through a particularly difficult time. They may be struggling with their way of thinking, with their feelings, or some challenging behaviour.
I think it's holding in mind that they are children. They're children that have struggled, whether it's because of a condition that they've got or because what they've experienced. But we try to look at what's driven that behaviour, what's the root cause of it, what keeps it going, and how do we work together to manage it.
The unit's part of Alder but has its own grounds in Waterloo, some 8 miles from the main hospital.
If it was a really big gust of wind, it'd be very different, wouldn't it?
It's the first time cameras have been allowed in here to film. I've been able to spend some time talking to the staff that work here and some of the young people they help, but we can't identify any of them, so their words have been voiced by actors.
I felt nervous and upset about coming here, but it's not what I thought. It's very colourful and we can decorate our own rooms.
So this is where all the kids' bedrooms are. It can be daunting. Most of them haven't even been out of their family home, so to move away and live up here with strangers. But we always try and make them feel as at home as possible.
We can get quite attached to the children. Some of them are with us for a very long time, so I think it's, you know, often the endings are as hard for the staff as they are for the children and the family.
The longest they've had a child stay with them was 2 years, and many of the patients are here for several months, and because of that, the unit has its own dedicated teachers.
When they're confident and they're happy and they're engaging in their schoolwork, ultimately then they're ready to leave us. So we know at that point, you're ready then to go back and enjoy life.
Each child that comes in here, I want them to be able to grow their wings. Each hand that's on it represents every single staff member that's in here, because actually the children that's in here aren't going to grow on their own. They need us behind them. And then hopefully when they walk out, we've made a difference.
The last 12 months have seen many young people's lives turned upside down due to the pandemic. The fallout of that has seen demand for this type of service soar.
We would normally get an occasion where we had a gap of perhaps a week before our beds were filled again, and we're finding that we're not having any of those gaps. It's just ongoing, and there's always somebody in the country waiting for a bed.
One young person who recently returned home after spending most of the last 12 months here wanted to share this advice.
Just let people know you're struggling.
Just seeing them leave what is a 24-hour, 7-day-a-week inpatient service to actually step down to home and school is absolutely tremendous.
We're not here to fix them, we're just here to kind of be that blanket. And it's so lovely to see them leave completely different and just so bright and happy in themselves.
I'll leave you with this, a poem written by some of the young people here. They describe it as their motto for their time spent on the unit.
The spirit flashes like a jumping salmon. Although the salmon may be caught on a hook, the fisherman may not capture its beauty.